name is Evelyn Gut, Charitable Gift Advisor, and I will be your host today. And Jasmine Rodriguez, Annual Giving Officer, is my co-host. So thanks for joining us today. We have about 45 people on the call, and we have been talking to donors during the coronavirus pandemic. And the most common asked question is, how is it going? We've sent email reports, we've posted on social media and mailed newsletters. However, donors are really curious to know what's it like on the front lines and what kind of challenges are we facing. So the best way to illustrate is to have our Salvation Army reps from the front lines tell you in their own words. So we asked 4 of the ministry unit leaders from different parts of our province and invited them to tell their stories, tell us what they're seeing on the ground. We want to keep this real and true to life of the efforts by these leaders. We look forward to answering your questions about the content that you're going to hear today. And the 4 leaders are Executive Director Emmy Skates, Langley Gateway of Hope Shelter, Major Sheldon Feener, Victoria Addictions and Rehabilitations Center, Lieutenant Sabrina Silvey, Prince Rupert Corps, and Executive Director Cameron Eggie, Fort St. John Center of Hope Shelter. So a few housekeeping notes. You can submit your questions via the chat bubble just down below at the bottom of your screen, and we will ask as many questions as we can at the end of each speaker. You can change your view of the speakers by selecting the gallery view. It's at the top right corner of your screen, and we're recording this session so that we can share it on our website and via social media for others to hear later. If you're having difficulty hearing, please check your speakers lower right-hand side of the screen. And if you could please leave your computer mic in mute mode so that we don't hear outside chatter. So I'd like to introduce our divisional commander of the BC division, Jamie Braund, who would like to say hello and welcome.
Thanks, Evelyn. Hello and welcome. This is exciting to be able to see all of you. It's really quite remarkable. Thanks for joining us. As Evelyn said, I'm Lieutenant Colonel Jamie Braund, and I'm the divisional commander or the leader of the Salvation Army for the province of British Columbia. On behalf of my wife, Anne, and myself, first of all, I want to begin by hoping that your families are well and staying safe during this time. We also want to thank you for your generosity and support. It's because of you that we've been able to respond in the way that we have during this pandemic, and we look forward to sharing some of that with you today. I've said it in the past, and it's become a bit of a slogan, but I believe it's really true that together we really are going to get through this. And so from the beginning of this pandemic, we've been an active part of supporting communities across British Columbia in almost 60 communities and approximately 400 communities even across the country in Canada. As one of the largest providers of social services in the province and in the country, we've been considered an essential service. So when everybody was locked down, we were actually very active still across the province as one of the essential services providing frontline assistance to people. This pandemic has certainly caused us to have to do things a little differently, and so we've learned how flexible we are when we didn't even know that we were, and we've adapted so that we can continue to serve in many ways across the province of British Columbia. Today you're going to hear some stories about how we've been able to adapt and to serve and to meet growing demand. Honestly, it's only because of folks like you that we've actually been able to do that, because of your generosity and support, and so we thank you for that. One of the things that we've experienced over the last couple of months is a really increased demand for services. In some communities, it's almost been tenfold in terms of the need of people in the communities. I witnessed this firsthand one day. Anne and I were volunteering in Vancouver at a food distribution place, and lineups and the people that had never come before for help, and it was really quite remarkable. We also noticed the really incredible generosity of the community from individuals and friends, from corporate partners, and I think in ways that maybe have never happened before, people have come together in our communities to partner together to help others, and that's been really exciting to be able to see. Today you're going to hear some stories from the front line from 4 locations, and we hope that it'll help you to get maybe a clear understanding of who we are and what we do and the impact that we've had in our communities. From Vancouver Island to Prince Rupert and other places in between, you're going to meet some of our leaders. As the leader of the Salvation Army, I'm so blessed and encouraged by the people who work for us and serve with us. And we've got amazing leaders across the province, and you're going to hear from 4 of the best today. And so I hope that you'll really enjoy hearing from them and get an idea of how they're helping in their communities. So without any other further hesitation, I want to turn back to Evelyn, who's going to guide you through this presentation. Thanks so much for joining us, and God bless you all.
Thank you so much, Jamie, and for keeping the ship right for all of us during this challenging time. And now, without delay, we will give each location the opportunity to speak for 10 minutes on the impact of COVID-19 in their regions, what they're experiencing, how the needs in their communities have changed, and a testimonial story of a client. Again, we'll put forward your questions to our speakers, so please submit them in the chat box. And without further ado, we'll start off with Executive Director Emmy Skates, Langley Gateway of Hope Shelter. Go ahead, Emmy.
Thank you very much, Evelyn. Good afternoon, everyone. My name is Emmy Skates, and I work at the Salvation Army Gateway of Hope in Langley. I have been a Salvation Army employee for just a little over 11 years. I began working with the Salvation Army as a shelter worker at the Salvation Army Belkin House in Vancouver. And then I moved down the street to the Salvation Army Harbor Light, and I worked there as the detox manager and also as the manager of addiction services. And now I am in Langley, and I have been here for 4 years. In 22 days marks my 4-year anniversary. So it's great to work in such a great community like the community of Langley. COVID-19 has changed the way that the world operates, and it has changed the way that the Salvation Army operates. We, in December, it's our Christmas season. I would say that December is the busiest time for most Salvation Army ministry units, and that is definitely the case for the Salvation Army Gateway of Hope. Back in the day, prior to COVID-19, in December, we would pack 300 hampers for adults and couples without children. And the Langley Christmas Bureau would pack hampers for families in Langley. And we used to think that packing 300 hampers in December was a great task. But since COVID-19, we are packing hampers on a weekly basis now. That started through a phone call that I had with other community leaders in Langley, with the RCMP, Fraser Health, the leaders of our municipality, the mayors, other nonprofits and service providers. And on that call was the Langley School Board. Initially, that call was meant for us to connect to see how we could get PPE for our ministry units or for our organizations. That was a huge concern for us at the beginning of COVID. But what turned into trying to secure PPE across our community, there was a conversation with the Langley School Board, and there was a recognition that there was some need for some families who were struggling with food security. And these were families who had never required the assistance of the Salvation Army Gateway of Hope. But we were very lucky to have received a donation through Agriculture Canada for food security. So we decided to partner with the Langley School Board, where they would identify the families that were in need, and we would provide the hampers. So when we started, all our employees at Gateway of Hope rolled up their sleeves, and we didn't know what to expect. So the first week, I think we had about 5 families. The following week, we had about 12 families. And today, as I'm speaking right now, I have my team preparing about 55 family food hampers for people in our community. I was connecting with my operations manager, Julie, this morning, and I was telling her a little bit about the presentation, and we were sharing the numbers, and she mentioned that actually next week we are up to 75 food hampers for families in the community. We're also distributing about 50 food hampers to individuals who are homeless and have been displaced in hotels. So what we thought was a great effort in December with 300 hampers during that season, now my team is preparing 100 hampers a week for people in the community. So it's a great story though, because there is a family of 4, a mom and a dad, and 2 of their kids. They're 9 and 6 years old. And both parents had been or have been laid off because of COVID-19. COVID-19 has had a huge financial impact on our country and across the world. And they were a family, as our divisional commander mentioned, individuals who had never reached out to the Salvation Army or required our programs and services. And they were struggling. And so it was great for us to be able to connect. And COVID-19 has been very stressful on families. And so what we want to ensure is that food is not part of that. It's a great story, though, because the mom who works for a dentist spoke with our operations manager last week, and she informed her that she wasn't in need of a food hamper anymore because businesses are opening up, and she was able to go back to her job this week. So it's really great for us to be able to connect with anyone who comes through our doors, whether that's donors or volunteers, or a client who is in need of that service. And we really believe in creating those long-lasting connections with our community. Our shelter has changed. We are known for our shelters. We're known for providing food and basic needs, but we're also known for providing hope. During COVID-19, we were quite concerned what that was going to look like because there were physical distancing mandates, and we had to ensure that, one, we remained open, but that we remained open in a safe manner. So our shelter manager and our shelter supervisor were walking around with a meter stick to ensure that the beds were all 2 meters apart. And at Gateway of Hope, we have 62 beds. So we had to divide one shelter and put it in the other shelter where we have our common area. So we were moving furniture around and ensuring that we were meeting the 2 meters of physical distancing. Disinfecting around our building is a common thing. On the hour, every hour, we're ensuring that that is getting done. So our operations look different, but the one thing that continues to look the same is that we are continuing to serve the people who need it most in our community, and we're very proud of that. An employee said to me last week that I was connecting with them and just checking in to see how things were going. It's been a crazy time for us. And they said that as Salvation Army employees, we have been prepared for this pandemic because we are always at the front lines and we are the first to respond. And that's something that I'm very proud of. And I'm very proud of my team and our community for coming together to ensure that the needs of everyone in Langley, that their needs are being met. One of the things that has been difficult for our location is we've had to close down our thrift store. So part of our funding model is we rely on our funders, we rely on our donors, but we also rely on the revenue of our thrift store. And having to close down our thrift store at the end of March has impacted us financially. As I mentioned, the revenue comes back to Gateway of Hope to pay for the programs and services that we deliver. I'm happy to report, though, that we have a projected date to open our thrift store on June 22nd. There is a sense of normalcy coming back into our communities. It's coming back into Gateway of Hope. So we're really looking forward to seeing what that looks like. Shopping is different. We go grocery shopping each day, and that looks different than it looked like, prior to March 12th. But we recognize that our world is different, and we have adjusted to that. And the thing I'm the most proud of at my organization and at my ministry unit is that we've continued to remain open and to provide the services that are so needed in our community. So I wanted to thank everyone for attending today and for getting a little bit of a snapshot into what we're doing in different communities across Canada. But I also want to thank you for your long commitment to the Salvation Army and to the people that we serve. As Jamie mentioned, we're not able to do the work that we do in our community without any of you, without any of our volunteers, and without any of our staff. So thank you very much for all that you do, and we look forward to continue serving in Langley or Prince Rupert or Fort St. John or in Victoria. Thank you very much.
Thank you very much, Emmy. Emmy, I have a couple of questions. I know we had talked a little bit about counseling and how you were able to offer counseling to some of your clients there, even though you need to be aware of the social distancing and that type of thing. Can you talk a little bit about that?
Sure. Counseling is an important part of someone's recovery. It's an important part for our clients who are in our transitional housing program. So counseling, because of physical distancing measures, looks different. So now our counseling sessions are via Zoom. At first, it's a little difficult trying to connect, but our counselor, Carl, who volunteers his time here at Gateway of Hope, he was saying, you know, whichever way, whether it's over the phone or whether it's via Zoom, please connect us. And so it's great to see laptops opened all over Gateway of Hope and the counselor on the other side and people still connecting. So it's important to understand that even though certain things have changed, there's aspects of our programs that still need to remain the same. And counseling is part of that.
I know it's really important. Another question that we have is, you know, with the people that are receiving the food hampers and, you know, the kids and the families, how are you guys able to help keep their dignity? Because, you know, being in dire straits at this time can be it's very stressful already. And, you know, how are we able to, or how are you able to keep their dignity?
Thank you for your question, Evelyn. I think one of the things that has been really great is that we deliver the food hampers. So, you know, we don't have people lining up outside, one, because of physical distancing measures, but it's also a way to connect. So it's not just, you know, someone shows up and picks up their hamper. We're actually going to their home and trying to make that connection. So the other thing too that we communicate is that we are all in this together, as Jamie mentioned. So people who had not required our services before require them now, and we explain that has become very common in our community. So part of it is, you know, finding other ways to logistically distribute hampers, but then also connecting with people when we do deliver the hampers, and, you know, saying hello or connecting with them and asking if there's perhaps any other resources that they may need. So we really believe in creating that long-lasting relationship with the people that require our services.
Thank you very much, Emmy. That's it's really valuable to hear how you're doing things at the shelter now, and you're serving more than just the homeless. You're also actually helping the community as well with, you know, with the food hampers. So thank you. And next we will move to Major Sheldon Feener, Victoria Addiction and Rehabilitation Center. Go ahead, Sheldon.
Thank you, Evelyn. Thank you, Emmy, for sharing so passionately. It's great to hear what's happening in other communities. And thank you, folks, for joining us today. My name is Sheldon Feener. I am the Executive Director of the Addictions and Rehabilitation Center here in Victoria. I am just starting my 4th year here, and it's an incredible privilege to serve here. The ARC is a 150-bed facility. We have a shelter transitional housing program. We're about to start our new treatment program, and we also run a halfway house. When COVID hit, we were prepared. We weren't prepared. No one was prepared, but we were ready to hit the ground running. The first thing we did was set up a dorm in our chapel. We're blessed to have a lot of space here. So we set up a dorm in our chapel so we wouldn't have to lose guys. We had enough room here to be able to keep our facility full and be able to social distance, be able to have all of our guys stay. So we moved some beds around. We set up a dorm in our chapel so all of our guys could stay. But what we noticed was the city promised guys who were moving to the tent sites and the tent cities that were set up housing. So a number of our guys left on their own choice, by their own choice, because of that promise. So we had in a number of different campsites about 800 guys who were out on the streets with a promise of housing. And unfortunately, we didn't have 800 housing units available. So we are currently sitting at about 60% capacity because so many people left with the promise of housing, and then not as many units came available. So there's an awful lot of people still out on the streets and a number of shelters with intakes that haven't started yet or are starting very slowly that aren't at capacity. We reduced our staff to essential staff, and we ran with a skeleton crew with other staff doing work from home. And the reason we did that was because we knew how serious COVID was. Everyone knew how serious COVID was. And we thought that with the community that we serve, it really was essential that we had staff who were healthy and well at home, so that if COVID entered our facility, we had healthy staff that we could draw at home to bring in when we had staff who were ill that had to leave, that had to go home and recover and get well. We had healthy staff that we could bring in. We installed a hand washing station in our front lobby. No one came into our facility, into the secure part of our facility, whether they were staff or residents, without first sanitizing, washing their hands, and then they could have access to our building. We removed chairs from our dining room. We added hand washing stations at the entrance of our dining room. But the biggest difference that we noticed wasn't really inside our facility. We went on doing what we were doing. The biggest difference that we noticed was what we were doing outside of our facility. We started doing a feeding run for people in our community. We were doing about 200 meals 3 times a week. We always did our community lunch that was carrying on, but we used our community response unit, and we were going up Monday, Wednesday, and Friday, and we were feeding people who were homeless, who were living rough, who were living on the streets, and we were feeding them every Monday, Wednesday, and Friday, about 200 meals. And we were visiting the different tent sites and the other places where we knew that people were just living either individually or just 2 or 3 people gathered. And we were feeding them 3 times a week, about 200 meals. And then a couple of weeks ago, I got a call from someone from the Capital Region District who asked me if it would be possible for us as the Salvation Army to take on that feeding ministry 7 days a week, 3 meals a day.
Wow. And
I said yes, because we're the Salvation Army, and that's what we do. We give hope, and the people that we were serving didn't know where their next meal was coming from, and I didn't know how we were going to do it. But I knew that we were going to do it. So I said, yes. And he said, great, can you start tomorrow? And I said, no. I said, you've got to give me a little time. That was on a Thursday. And I said, give me until Monday. And Friday, Saturday, and Sunday, we put a plan together. And we're just about finishing our 2nd week of doing that. It's going to go on for the foreseeable future, but we're doing between 500 and 600 meals a day, 7 days a week. And we've reached out to the other ministry units in the city, and they're helping us. And it's actually been an incredible blessing to be able to go out and to give food. We do 2 hot meals a day. We do a hot breakfast and a hot supper and a bag lunch. And it's just an incredible blessing to be able to go out and feed people who don't know where their next meal was coming from. Now they do, because they know we're going to be there every day, and they know that they're going to be provided for. I was chatting with one of our residents the other day, Mark, and he was telling me how grateful he was that in spite of everything that's going on, we're still open, we're still operating. He told me he was in his caseworker's office. He was on the verge of a full breakdown. But his caseworker managed to talk him through it, to take him through it step by step by step, help him focus on what he could control, make some positive movement forward. And he said, even through the most difficult of circumstances, he's always been able to help me. And then he stopped and he looked at me right in the eyes and he said, Sheldon, he literally saved my life. Just to know that we're able to keep people alive, safe, and healthy during a global pandemic is an incredible feeling. And it makes me so proud to know that my staff are making a difference in people's lives. One of the things that I've realized is that not only are the people we serve vulnerable, but the people who are serving them are vulnerable. So we've brought in an outside counselor. She comes in 1 day a week. She sits in an office on the mezzanine, and she's available to our staff. And they're taking advantage of her, but just her very presence here, so that my staff know that there's someone that they can come and talk to, that they can just come and unload onto and release some of this stress and pressure and COVIDness that they've been building up for the last 2.5 months. Has been such a relief for them and a release for them. Some of the positives that I've seen come out of this are this. Guys are still accessing our services. Our programs are back up and running. Men are still being housed, and our in-house counselor is continuing to see men and make an incredible impact in the lives of people that are still using her services. They're being done over Zoom, they're being done by the telephone, but she's making a difference in their lives. People are being fed, people are being hydrated. We're getting to know more of the street community so that when the time comes and when they're ready, they're going to be comfortable accessing our services. And most importantly, we're still giving hope today. We couldn't do that if it wasn't for your generous support and you taking the time to realize that the Salvation Army is making a difference in the lives of people. Thank you so much for what you do so that we can do what we do.
Thank you very much, Sheldon. And I know how passionate you are about the work that you do over there at the ARC. We have a question. What will happen once those who were rehoused in hotels are told to leave the hotels? What's the plan for that? Do you have any idea?
So we've been talking with some of the people from the Capital Region District. We've been talking with the downtown service providers, the Greater Coalition to End Homelessness. We're working together with them to try and formulate a plan. Right now, it's in the beginning stages, but we're certainly not going to leave them to fend for themselves. We'll certainly be a part of what is happening, but the plan is in the beginning stages.
Okay. And I know you mentioned about the counselor that's coming in to help with your staff and that. Are you seeing a rise in depression or emotional disorders amongst your clients?
We're certainly seeing, so that the counselor that we brought in is for our staff, but our staff counselor for the clients has certainly been seeing a lot more of the guys, and her services are being accessed a whole lot more.
Yeah. And what does that look like? Are they able to come more often then? Is that
Yes.
how that works?
Yeah, so she has her schedule is filling up, but her job is literally to spend time with the guys. They make appointments, they go see her. So her schedule is filling up every day with guys just coming to see her, to unload, to talk, to make plans to better their future.
Right. And how is it going? I know you mentioned the feeding or the meals, the community meals that you're doing for the public, and you're doing 300 a day now. And how is that going? Are you doing that with staff, or do you have volunteers that are helping with that?
So we're actually doing closer to 600 a day.
600 a day.
So we're doing it with, we've got some staff that are doing it. We've got some volunteers that are doing it. Other ministry units have stepped in and are helping us take some. My goal, my plan would be to do it with as few staff as I can, because I'm trying also to run the ARC. Mm-hmm. But my staff have such incredible hearts that they want to be out, with the people who are living rough and sleeping on the streets, because that's their passion, that's their heart, that's their desire. They're their people. They want to be out and getting to know them, because it makes it easier for them to come in here as well. Right. But they also need to be here and running the ARC. So it's difficult. But yeah, I've had staff, I've had people from DHQ come over and help. Mike Leland is here today doing it. So I'm happy to have volunteers doing it. Anybody really who's got a heart and a passion to help is welcome to come and do it.
Right. And you've got the protocols in place, right? Because we need to do this with the proper protocols, PPE and...
Absolutely. Yeah. Yeah. We take every precaution.
Okay. That's wonderful. Thank you very much, Sheldon.
Thank you.
Okay. All right. And now we're going to hear from Lieutenant Sabrina Silvey from Prince Rupert. Go ahead, Sabrina. Sorry.
Good morning. So I'm Sabrina, and I have had the privilege of serving here in Prince Rupert for the past 3 years. I just want to start by saying it is such an honor to be able to speak to you all this morning, and I hope you're all well and safe. I just want to start by saying thank you. Your support, all you do, is so appreciated. And I know here in Prince Rupert, without your investments, we would not be able to achieve all of our goals in serving our community. What you do matters. Your support, your investment has the power to impact people's lives in amazing and practical ways. So thank you. So here in Prince Rupert, we run a thrift store, a food bank which serves hundreds of hampers a month, and a soup kitchen that serves over 200 meals a day. Right from the beginning of COVID-19, we were able to make changes so there was no interruptions. As soon as those many emails started crossing my desk, my team was able to implement changes so that we could keep going. And I'm happy to say that here in Rupert, we did not miss a beat. We were able to continue serving every day without interruption. So one of our programs is the soup kitchen, and we were able to switch over to a takeaway system. And we were able to get our equipment right away so that we could just keep serving. Normally when people come in for food, they will come through our church and into our gym where they'll sit down, they'll have a hot meal and drink coffee and just chat with each other. But because of everything that happened, people were not allowed to have full access to our building anymore. So we switched over to a system where our clients are coming into our lobbies one at a time and receiving their hot meals to take with them. We serve breakfast and lunch 5 days a week, and most of those meals are hot meals. So for instance, French toast, hash browns, and sausage for breakfast. And today, right now as we speak, they're having hamburgers and salad. We also pack at lunchtime bag meals for them to take with them. That way, when they get hungry later, they have something to eat. Now, it is because of funding, it is because of people like you that we were able to continue without interruptions. As most people know, when there's change, there's usually cost associated with that change. And because of the generosity of you and because of the generosity of Prince Rupert as a community, we were able to do what needed to be done to keep serving the community. Now, we've noticed a lot of people handle this new way of life differently. And one of our goals here, our main goal here in Prince Rupert, is to meet people's needs the best we can. And meeting people's needs looks so different depending on the situation and the circumstance. One of the things I first started noticing when this all started to happen, within the first few weeks, I noticed that my homeless clientele that I was speaking with were really deflated. They were scared and they were angry. They don't have the same access to social media, to the radio, and to television that we do. They saw all these big changes happening around them. Doors were closing. Places where they normally get to spend time in were closing. Our grocery stores were getting very empty and people were walking around with masks. And this scared them. And they didn't know why this was happening. There was talk on the street, but they didn't have the big picture. So one of the ways we tried to alleviate some of this stress and some of this anxiety was we started playing CBC News in the background. That way, when people came into our building, they were able to hear the news stories. They could hear what was going on in our world. They could hear what was going on in Canada and in British Columbia. This is just an example of those unique needs that are popping up during this time that we're trying to fill. Our food bank also had to undergo some changes. Normally we have this great one-on-one interaction with our clients. When they come into our building, there's conversations that happen. Our team catches up on their lives and we offer prayer support. But because of all of this, we had to change how our food bank looked. And in order to keep everyone safe, we switched over to a delivery service. So now when people call in for their food, we bring it to their doors and we leave it just outside. This was one of the changes we made during this time to keep everyone safe and still serve our community. We also, right from the beginning, had to tell our volunteers how amazing and loved they are, but ask them to stay home. And these are the people that help us run our programs on a day-to-day basis. It was really important to my team and myself to just do everything in a safe way. And we really wanted to support the health authorities' stay home and stay safe model. And I think we've been very successful at doing this and still serving our community and meeting those needs. Although we're no longer having this one-on-one interaction in person with our clients, I am finding that when people call in, especially seniors, when they call in to book their food delivery time or to see what services we have, and even the people who are calling in to see how they can help us, I've noticed these conversations are lasting a little bit longer and a little bit longer. People are really lonely right now. People are scared and people are anxious, and they need that safe place to just tell us what they're experiencing, to talk about their feelings. And a lot of people don't have somebody to talk to. I think it's such a beautiful thing that when my team picks up the phone, we can be that safe place for people, that we can be that listening ear. One of the goals of the Salvation Army is to bring Jesus to people. And as a pastor, this is incredibly important to me. And I've noticed that people's spiritual needs, we're seeing an increase in people calling in for help in this area. I have pastoral care sessions several times a day now through Zoom and through Facebook Messenger. And these are people in our community who don't normally come to church or are associated with a certain church. And I'm finding people's spiritual needs are huge right now. I'm receiving more phone calls in the last 3 months than I have the last 3 years. So that's just another example of how we're meeting unique needs during this time. Mm-hmm. This has also been a time of learning lessons. And some of these lessons we're learning, we're actually able to take back with us and change how we do ministry on a day-to-day basis. Because of COVID-19, we've actually seen areas in our community that are needful and we didn't know about them. So because of COVID-19, we're able to meet needs in different ways than we were, and we're able to bring this back to the table and figure out how to move forward through this and continue meeting those needs as we go back to normal. So this is Prince Rupert. This is what our programs look like right now. We're still here, we're still serving, and it's because of the generosity of our community and because of the generosity of British Columbians that we've been able to continue to serve our community and to meet needs in the safest way possible. So thank you for letting me come and speak with you this morning.
Thank you very much, Sabrina. We so appreciate what you do up there. And I know it's a completely different, it's a unique location. I know that when you and I talked about this, you had mentioned that where a phone call for a food hamper would normally be a really quick conversation, and now it was taking up to an hour. And yeah, can you talk a little bit about that from the individuals?
Sure, yeah. So actually yesterday, I had a lady call in to book an appointment, and 2 hours later, I was hanging up the phone.
Wow.
And we were scheduled to meet last night over Zoom. Um, People need people to talk to, and being shut in and away from everybody, it's really hard to do, especially I'm finding seniors, right? They're scared, they're alone, they're not allowed to go out because they're high risk, and they just need that connection. They need somebody to talk to, they need that listening ear. And so yeah, I'm finding conversations are lasting a lot longer now, which is beautiful because it's just another way to interact with people without being there in person.
Yeah. Wow. 2 hours. That's amazing.
Yeah.
We had also talked about how the food banks, or not official food banks, but the other food locations, food shares, I guess, in Prince Rupert had closed down, and yours was the only one that was left open.
So we are the main food bank in Prince Rupert,
Okay.
and we were able to stay open, part because we have this great team here, and they're so dedicated to serving the community. And also we were able to stay open because of the support that we're receiving, because of funders, because of the support in Prince Rupert. Right in the beginning of all this happening, our grocery stores ran out of food and our food bank ran out of food.
Oh.
We had no way to purchase food in a bulk way in order to keep feeding people. Because of support, because of funders, we were able to purchase a large amount of gift cards. That way we could hand gift cards out to families and individuals, and they could go into the grocery stores and buy their allotted amount of supplies. So really, we were able to stay open because we have a great team and such a supportive community and province.
Right. Yeah, I know it's hard for the grocery stores sometimes to give the food banks allotments. So in our locations around the province, and so, but for the individuals, it's easier if they have a gift card, they can still access the food, and so that's great. And yes, we have great partners that helped us with that as well. And so thank you very much for what you do up there in Prince Rupert.
Thank you.
Okay. And now, last but not least, we will hear from Cameron Eggie, Executive Director of Fort St. John Shelter. Go ahead, Cameron.
Good morning. Thank you everyone for being here. It's really great to hear from my colleagues in the South. And it's funny to hear Prince Rupert as reference to up there,
Yeah.
because we reference it to down there. As Evelyn mentioned, my name's Cameron. My wife and I are blessed to serve in Fort St. John. I've been with the Salvation Army for just over 11 years and 2.5 up here in Fort St. John. In Fort St. John, we are the main expression of homelessness and poverty support, in the sense that the Salvation Army operates the only emergency shelter for men and women in the region. We have 50 shelter beds right now for men and women and 36 transitional housing beds. It's important that we have enough room for anyone who's experiencing homelessness, for anyone who needs to isolate, especially with the way the world is happening right now. But we're also the expression of a food bank. We are the only registered food bank in the region. So right now we serve about 1,200 people, making up for about 500 families in our community. Our city's population is just over 20,000, so that it is a considerable percentage of people that rely on the service of the Salvation Army for their daily needs. As many of my colleagues expressed, everything has changed since COVID. In smaller communities, our teams are smaller, so a lot of our efforts are required on the front lines from everyone. It's all hands on deck. And one of the greatest things that has happened in the last 2 months is our donors and community support reaching out to me, phoning my cell phone, emailing through our website and saying, we know you need help. You don't even have to ask, we know that this is going to be a trying time. So when I'm able to come back to my desk and see emails from donors and supporters saying, we want to come alongside you, we want to ensure that you don't have to lose focus of the front line, that you don't have to go sourcing that. It's been such an incredible blessing for my team, for myself, when I'm able to go back and say, we have support of our community. our frontline staff see that. They recognize when their leaders are calm, and we're able to be calm in crisis because we have the support of our community, because we have the resources funneling to the front line. And as a leader in a small community and as a leader with a team delivering these programs, it's vital for our success. It's vital that we have that support. Our team has been blessed in the camaraderie they're experiencing, working in tighter, smaller teams, as Sabrina mentioned, having to navigate our volunteer program to ensure contact is done responsibly and safely. We're seeing relationships built. We're seeing truly everyone in that together, even with our service users and the guests that come to sheltering. They're appreciating the effort that the staff are putting on. They're helping each other. So it's really interesting to see hope giving birth during crisis, and to actually see people coming alongside each other, working together. And the sense of team has never, I've not felt more sense of team over the last 3 months than I have since being in Fort St. John. As Emmy mentioned, our thrift store in town does fund our food bank. Our food bank relies on the operational expenses covered through our thrift store. And when that had to close, we were concerned. We do prepare. We have, you know, we try to be good stewards of our finances. We try to ensure that there's something there. But when pandemic hits, it does cause concern. In the first week, we had corporate and private donors asking, how much is your hydro bill? How much is your gas bill? We want to ensure that the operational costs of the food bank do not get interrupted. And that was an incredible weight off my shoulders, an incredible blessing for the Salvation Army to feel the trust of the community, to feel the trust of our donors that we're doing the work day in, day out, and they wanted to support us. I don't think, and for those of you listening, I hope you truly understand, like, that is just an amazing emotion as a leader on the front lines, to know that we will have the resources to meet needs. As we see more people coming through the door, I think we average just over 60 more families coming to the food bank since the outbreak of COVID. The narrative being the same, job loss. And we have seen a couple of families not return because jobs were restored, which is a really wonderful thing. But they came in very defeated and deflated, feeling shame and struggling with pride, having to ask for help. And so it's important for us to have a dignified approach when they phone in. The delivery model I wasn't sure about, but it really has been working well, because as was already mentioned, we get to go to someone's home. It is a way to keep a mom and her children at home instead of venturing out, risking contamination. Our driver comes back with stories over and over of people expressing just heartfelt thanks. And for him, as an employee of the Salvation Army and relatively new, it's really encouraging him that he chose a good organization to be a part of. One story that stuck out, and I've shared it a few times now, but we had one company pre-COVID reach out saying, our team has raised some money. We would really like to bless a family with a large birthday party for their children, an event that they may not otherwise have. And we thought that was wonderful. We started going through our list, and then COVID hit, and there were no large gatherings, large parties. So I reached back out to this individual, and he said, well, then we can help more kids. And so let's take the money that we raised and let's help more families. So a week before last, we had 3 families come with 7 combined children with birthday parties in May and June, and their presents were provided, gift cards for mom and dad to go and buy the food, the birthday cakes. These families were not anticipating a call from the Salvation Army saying, hey, there is a person in our community who would like to remain unnamed, who would just like to help you and your husband, or you as a single mom provide your children with something. And the 2 of them cried right off the bat when we said, listen, there are people in the community that care about you, and we're just a vehicle to help make that connection. And one of the ways that we offer these birthday programs and these gift programs is, it's not a gift from the Salvation Army or from a donor. This is a gift from mom and dad. So mom and dad come in, they get the wrapping paper, they get the bows and the gift cards, and they get to go home and give their children a gift. And I think that is so important and so special, that we maintain that dignity for mom and dad, or for mom or just dad, to say, I can provide. And even when I can't, there's people there who care about me, and people in the community who care about programs like this, that see dignity restored, that offer hope through crisis. And we are very fortunate as the Salvation Army to be that vehicle, and it is truly an incredible blessing. Like I said before, and I can't stop saying enough, the folks calling in asking how we're doing. Longtime donors checking in, brand new donors who say, I know there's a need. Local radio stations, actually, I heard an ad about the Salvation Army Food Bank and Emergency Shelter needing support. And I messaged the manager because I didn't ask for that ad, but it was a wonderful ad because they knew that we're busy on the front lines and that we're going to need that support. One small example of allowing more time for us on the front line to spend, with our teams, to spend coaching and mentoring, and like Sheldon said, putting people in positions to help our frontline staff, because while they're serving, our staff are still vulnerable. There's still people with families who come to work willing to serve, many who have children, many who are believing in the mission. When they see a donor align with that mission, and when they see a partner in ministry come alongside them, it encourages them. It keeps them coming to work. It keeps them serving. And when that happens, more folks who walk through our doors reap those benefits. And as it's been mentioned, our programs were built around connection and community. That is really what we see as a transformative portion to having a person walk in the door and walk out a different changed individual, is community and connection. So what COVID has done is destroyed a lot of that connection. So we are having to be innovative and creative in how to bring that back through Zoom, through chairs further apart. But it's important that we keep doing that. And when it is safe, that we integrate some of these connection community programs, because I don't believe in Fort St. John we exist just to give a bag of food. We exist to give that bag of food in the name of Jesus and in the name of connection and community, because we know that's what changes lives. And so hearing from other colleagues around the province that we're experiencing the same thing, even for me, it helps to actually truly feel like we are in this together. And to see some familiar names on the screen, that's been really neat while listening to my colleagues, because I have been around the province and I see some familiar names on this Zoom call. And it's encouraging that even in the remote north, that we can feel connected to our funders and donors from around the province. So thank you very much for that.
Thank you very much, Cameron. I know that when we talked this week about this event today, you had some really interesting story about food sharing that you had up there, and we don't see that down here. And I was wondering if you could expand on that for us.
Right. So being the registered food bank with Food Banks BC and Canada, there's a lot of innovative programs that are presented. And 2 years ago is perishable food recovery program. So actually going to retailers and donors and collecting fresh protein, produce, and dairy. And through this program, we've been able to secure almost 1,800 pounds every morning from food that would otherwise be sent to a farmer or composted. And we're able to feed the public with fresh food. And that has exploded into wildlife programs, where we have a license where right now there's an outfitter who has a contest for who donates the most wild game through a butcher. So we've had bears,
Wow.
goats, moose, elk. This is very important in the remote north, because this is traditional food that people grew up with. And for us to give that, even if we may not eat it, is a form of us restoring dignity, bringing hope, and actually saying, we're not going to tell you what we think you should eat. What does the folks in rural northern BC enjoy eating? Let us source that and then bring it to the front line. So that's been a really encouraging program.
That's a really great program. I was really pleased to hear about that. As well, I know that you have been working with BC Housing on creating a program up there. Can you talk a little bit more about that?
Right, so as the only sheltering provider, when a new program is necessary, we are getting often the call first saying, can you do that? And as Sheldon mentioned, the answer is yes, we will find a way. It is our nature to provide housing and homelessness support. So like the motel program that's happened in many parts of the province, who might be an operator outside of the Army, we do operate that program in Fort St. John. So it is an extension of our emergency shelter, where we deliver meals to the motel. We have support workers going there daily, meeting with these folks who are encouraged to isolate, but may not have the means to isolate in a home, or if they don't have a home and they can't isolate in community. So within our shelter, we've had to create isolation rooms. We've had to create spaces for this response. And so it's good that we have the capacity, the resources, and the support in Fort St. John, the trust of our city and community to say we can respond to a need through BC Housing to provide homelessness supports.
Wow. You talk about isolation rooms. Can you expand on that a little for our listeners in that? I've talked to some of the people that are operating the shelters, and they all have different ways of how they run an isolation room.
Great, thank you. When the pandemic hit, any sign or symptom of cold or flu, folks were encouraged to isolate for up to 10 to 14 days.
Okay.
Anyone who's been around sheltering knows that some of our folks, they are more prone to pick up symptoms, whether it is COVID or general flu. And so when this happens, we had to make quick decisions about how do we safely isolate someone who is homeless, who is encouraged not to be out and about. So we're fortunate in the design of our building that we have additional dorms, and normally those dorms are used for extreme weather response for 5 months out of the year. It does get to -40 in the north, so it is actually an extreme response. And so on April 1st, when that program would traditionally end, we were able to extend that as a COVID response. So those dorms would be converted for someone who needed to isolate. The motel is important in Fort St. John because not everyone can isolate in community. In the shelter community, if an individual is struggling with mental health concerns or addiction concerns that make it isolating really difficult, we have a hotel option for those folks that would act as an extension of this COVID expansion program.
Okay. Thank you very much. I really appreciate that. And that brings us to the end of our speakers. And we are coming up to noon, and I don't want to stand between anyone and their lunch. So we will thank our speakers again for taking the time out of their day to share with us the view from their Salvation Army ministry units, and thank them for the work that they do again. And they were Executive Director Emmy Skates, Langley Gateway of Hope Shelter, Major Sheldon Feener, Victoria Addictions and Rehabilitation Center, Lieutenant Sabrina Silvey from the Prince Rupert Corps, and Executive Director Cameron Eggie, Fort St. John Center of Hope Shelter. I want to take this opportunity to thank you, our valued donors. All the work you heard about here today is only possible because of your generosity. Without you, we would not be able to fill these gaps and provide for our most vulnerable. So on behalf of myself, our team, and those we serve, thank you for helping us give hope today and every day in communities across our province. We welcome any feedback or questions that you may have. If we didn't have time to answer them today, please do reach out to your contact, or you can reach out to myself. My email is Evelyn_Gut, that's G-U-T, @can.salvationarmy.org. And thank you so much for joining us today. Have a wonderful day and stay safe out there.